heard that shift workers often have sleep disorders. Is that true?
That is true. And in fact, there are many shift workers in the United States. They have trouble both falling asleep and they have trouble staying awake, performing their duties. Additionally, when they are going to their shift or when they're coming to their shift, many of them are drivers and they may be at increased risk of motor vehicle related incidents for two reasons. One, because they're not getting adequate sleep prior to their work. And two, when they're coming off work, they will have been awake for a long time and they may be driving at a period when the brain really needs to be sleeping. It's very difficult to summarize the treatment of shift work sleep disorder because it depends on whether the patient is regularly on a shift, which is always better than being on a rotating shift, and whether the person has an inherent tendency to be awake at a particular time of the day. But essentially, they need help with trying to regularize their schedules. They may need medicines to help them fall asleep on days that they work. They may need to take precautions when they're driving on the way home, and they may or may not need a medication to keep themselves awake. Most shift workers, if we give them a little bit of education and access to some medicine, do very well. Some of them need more detailed plans constructed for them. We've most recently seen the issues of shift work with air traffic controllers, and you're probably aware we're near a very big center. One of the US's biggest centers of air traffic control is a few miles away. So we do have several patients who have that profession who we've been able to help effectively with the right information.
How would I know if I had a sleep disorder?
Well, I would ask myself, am I satisfied with my sleep? That's usually the cardinal question. Sometimes your things are brought to your attention by other people who've seen you sleeping. It's not uncommon for instance, a young male to come in for an evaluation after his friends have heard his breathing or seen irregular snoring in sleep, for instance, traveling to see a game and sharing a recreational vehicle. That's very common. Or a husband or a wife or a girlfriend or a boyfriend being concerned about that. But certainly ask yourself, do I feel I get a good night's rest? Is my sleep refreshing? Or do you spend a lot of time tossing and turning in bed? Do you wake up in the middle of the night for reasons that aren't clear? All of those could be signs of a sleep disorder. Needing help staying awake should also bring to your attention you might need a sleep consult. If you think you're drinking a lot of coffee, if you rely on over-the-counter stimulants, if you are using a lot of caffeinated or high-energy drinks, these may also be a clue. Very big red flag should be if you're worried about yourself when you're behind the steering wheel. It's not uncommon for us to have 6 or 7 consultations a year with people who have already had a motor vehicle collision. But most of our patients, when we question them, will endorse things like being drowsy at the wheel, falling asleep at a light, near miss, almost striking another vehicle or a barrier, or lane drifting, going over the rumble strip. So anything that gives you concern that you're having trouble being alert or having trouble getting a restful or restorative night's sleep should bring to your attention you may need an evaluation. A lot of primary care physicians now are very well informed about sleep medicine, especially in this area, so you can have that talk with your primary care doctor and figure out if you need to see a sleep specialist, or you can self-refer to a sleep specialist and just have an interview. It doesn't necessarily mean that you're going to need a complicated investigation.
What happens when I come in for a sleep evaluation?
What we do is we ask you to do a bit of homework before you come, and you have a detailed questionnaire. It's based on a standard interview, which is often the longest questionnaire people have completed looking at their sleep. Some of my patients will say they didn't realize they had these many issues until they completed the document. And the reason for that is people get habituated to their abnormal sleep. So even though it's clearly not normal, it's normal for them, so it hasn't come to their attention. After that, they come in for a consultation. We review the questionnaire and we direct the questions based on what the patient has identified. We do a physical exam which focuses a lot on the head and the neck and the upper airway, which is of great interest to these patients. And then we decide on whether we need to investigate further or whether we can issue some recommendations at that point.
What is a sleep study?
A sleep study is known as a polysomnogram. It's an investigation that we perform in a sleep center, and that means you come into our sleep center, which is very much set up physically like a hotel. You will go into your own room. The room looks a lot like a bedroom with an ensuite bathroom, and you will meet your sleep technician who's a registered polysomnographic technician. They attach various monitoring devices to you after explaining the procedure, and they include monitoring all of the rhythms, biological rhythms, heart rate, respiration, snoring, leg movements. And once you're all attached, then they commence the study. You sleep at the time that you normally would. And it is a very private, very comfortable experience. And you have somebody who's called a technician who attaches various monitoring equipment to you. There are no needles. It doesn't hurt at all. Everything is self-adhesive and hypoallergenic. And you're allowed to sleep in your environment with all of these wires. Most people are concerned that it's very cumbersome, but you'd be surprised how easily most patients fall asleep. During the night, functions like the heart rhythm, oxygen levels, breathing patterns, the noise of snoring, and large movements, if someone is sleepwalking, for instance, or eating in their sleep, all of this will be monitored electrically, by videotape, by audio tape, and if there is need to intervene or keep the patient safe, the technician will enter and initiate treatment or safeguard the patient in any other way. That data is then very carefully scrutinized in the following days. So the patient doesn't usually leave with a diagnosis in the morning. We've acquired the data, that's why it's called an acquisition. And then the data, after it's been technically scored, is evaluated by a board-certified sleep specialist. We collect data in 30-second intervals, and we make a summary, and we issue a report, and then we bring the patient back to look at the report and some of the chief findings and decide on how we should go forward.
Where can I get more information about sleep disorders?
I usually tell patients to go to the American Academy of Sleep Medicine or the National Sleep Foundation. Both those sites are reliable information and available if you Google them. You can also call us at 1-866-WINTHROP, and you can visit us on the web at winthrop.org, and you'll find lots of material about this.